Hi everyone, my name is Mary Herbert and I'm a practice nurse. Welcome to my video, which is an educational video aimed at people with diabetes. Today we are going to be looking at the microvascular complications. These complications silently affect the smallest blood vessels in the body, leading to long-term health conditions. Let's dive in. I will help you understand what they are, why they matter, and how they can be managed. Diabetes is a chronic metabolic disorder where your body either does not produce insulin, type 1, or it does not use the insulin it does produce properly, type 2. Its challenges extend far beyond blood glucose levels. Microvascular complications are health conditions caused by the long-term damage to the tiny microscopic blood vessels in the body. Prolonged exposure to high blood glucose levels can thicken and weaken these vessels, affecting the eyes, the kidneys, and the nerves. There are three major types of microvascular complications in diabetes. 1. Diabetic retinopathy, the eyes. 2. Diabetic nephropathy, the kidneys. And 3. Diabetic neuropathy, the nerves. Each of these conditions can affect your quality of life. With early detection and appropriate care, they can be managed effectively. Let's take a closer look at each. Diabetic retinopathy affects the back of your eye, known as the retina. Exposure to high blood glucose causes weakening of the blood vessels, which leads to vision problems. The vessels can swell, leak fluid, and in some cases cease functioning altogether. As the condition progresses, abnormal blood vessels may form, further impairing your vision. In the early stages, diabetic retinopathy often presents no noticeable symptoms, making regular eye exams essential for early detection. As the condition progresses, symptoms may include blurring of your vision, dark or empty spots in your visual field, difficulty seeing at night, floaters, small dark shapes that drift across the field of vision, and even blindness. Screening for diabetic retinopathy through regular checkups, including a dilated eye exam, is mandatory every year and looks for changes in the retina. To prevent diabetic retinopathy, keep your blood glucose levels within target range, manage and control your blood pressure, stay active with regular exercise, eat a balanced diet, and avoid smoking. Once diabetic retinopathy is diagnosed, different treatment options are available. Medications injected into the eye. These drugs stop the growth of abnormal blood vessels and reduce the swelling in the retina. Laser therapy involves using a laser to seal or destroy the leaking blood vessels. It can prevent further damage but may not restore your vision loss. In advanced cases, surgical procedures may be necessary. Vitrectomy involves removing blood and scar tissue. Sounds scary, right? But it is preventable and treatable with early detection and good diabetes control. Diabetic nephropathy refers to kidney damage caused by the high blood glucose levels. The kidneys contain millions of tiny blood vessels that filter waste from the blood. Over time, high blood glucose levels can damage the small blood vessels, leading to kidney problems. Patients can develop swelling in their feet, ankles, and legs, have high blood pressure, weakness and fatigue, and blood and protein in the urine, which can be detected through a dip test. Screening can be done by a routine urine test to check for protein, specifically albumin, which is an early sign of kidney damage. Blood tests are also carried out to check kidney function, urea and electrolytes, and an EGFR, and regular monitoring of blood pressure, which can also damage the kidneys. Prevention can be achieved by keeping your blood glucose levels within range, which is the most effective way to protect your kidneys. Also, maintain good blood pressure within the target range, eat a healthy diet with limited salt and protein intake, and stay well hydrated by drinking water to support and protect your kidneys. Once nephropathy is diagnosed, different treatment options are available, including medications like ACE inhibitors and ARBs. These are prescribed to lower blood pressure and protect the kidneys from further damage. In severe cases, when the kidneys have stopped functioning, dialysis or a kidney transplant may be considered. Diabetic neuropathy refers to nerve damage caused by poor circulation and high blood glucose levels in the blood. It mostly affects the nerves of the hands, feet, and legs, but also affects other parts of the body, including the digestive system, the brain, and sexual organs. Patients can experience numbness and tingling sensations in their hands, feet, and legs, burning and pain in their feet and legs, have difficulty walking due to muscle weakness, digestive problems like nausea, vomiting, and diarrhea, and men can experience erectile dysfunction. To diagnose neuropathy, a healthcare professional will do a touch test with a 10 mg monofilament to assess protective sensation in the feet and note any areas of concern. Nerve conduction studies to measure the function of the nerves, and regular foot examinations to detect any sores, infections, or ulceration due to nerve damage. Prevention is more important than treatment. This starts with good blood glucose control, foot care with daily inspection of your feet for any cuts, sores, or blisters, wear comfortable shoes, and avoid walking barefoot. Exercise, which can help to improve circulation and nerve function. Stop smoking, as this can worsen nerve damage by restricting blood flow. Once diabetic neuropathy is diagnosed, treatment starts with medications for pain management, foot care with a foot care team, and therapeutic shoes may be required. In some cases, surgery may be needed to relieve pain or pressure caused by nerve damage, and in severe cases, amputation. To prevent these microvascular complications, maintain a good blood glucose level. Guidelines suggest less than 7%, or a target set by your healthcare team. Maintain a good blood pressure. Aim for a systolic less than 130 millimeters of mercury, or as advised by your healthcare team. Take your medications as prescribed, oral or injections, for your diabetes management. Eat a well-balanced diet. Exercise regularly. Avoid smoking and limit your alcohol intake. Attend your regular eye checkup appointments with your optician. Attend your diabetic eye screening appointment annually, and your diabetes annual review for regular assessments. Microvascular complications in diabetes may sound daunting, but knowledge is power. By understanding these complications and taking proactive steps to prevent or manage them, you can protect your health and improve your quality of life. Thank you for watching, and remember, staying informed is the first step to staying healthy. Take charge of your health today and speak to your healthcare team. Bye.